This particular session is about three confusing terms: arteriosclerosis, arteriolosclerosis, and atherosclerosis. Often these three terms are confused and by many. So what are the specific meaning of these three terms? Arteriosclerosis, which spells as ARTERIOSCLEROSIS, and arteriolosclerosis, ARTERIOLOSCLEROSIS, arteriolosclerosis. And the third term is atherosclerosis, atherosclerosis, SCLEROSIS. So the first thing that we need to understand that our arteries are quite stretchable and flexible. It's a blood vessel which is quite stretchable and flexible. So if any pathologic process makes this stretchable, flexible, elastic artery harden, the wall of the artery gets hardened and lose its elastic property. This process, this condition is called whole process. This is called ArteriOSclerosis, which spells as ARTERIO, arteriosclerosis, SCLEROSIS. Sclerosis means hardening. So this whole generic process where any artery which loses its elasticity, flexibility, and the arterial wall becomes hardened is called arteriosclerosis. Now this arteriosclerosis can occur in many forms, like atherosclerosis, where this arteriosclerosis process is involving smaller arteries and arterioles, or atherosclerosis, ATHERO-sclerosis, which typically involves the larger elastic arteries and the larger muscular arteries. The elastic artery is a big one, conducting arteries like aorta, particularly the abdominal aorta, and the large muscular arteries. That is called atherosclerosis. So basically, arteriosclerosis is the whole process. All atherosclerosis are arteriosclerosis. Similarly, all arteriolosclerosis, they are also arteriosclerosis. Arteriosclerosis is the whole umbrella term, which means hardening of the artery, where the artery loses flexibility, and it can occur in various forms. Typically, two common forms which are very, very significant are arteriolosclerosis and atherosclerosis. Having said that, they have other forms also, arteriosclerosis like Monckeberg's medial calcific sclerosis, fibromuscular intimal hyperplasia. But the two most significant things are arteriolosclerosis and atherosclerosis. So we right now know that the whole process of hardening of the arterial wall is called arteriosclerosis, and arteriosclerosis is many forms, and there are two key forms are atherosclerosis and arteriolosclerosis. Let me start with the latter one, that is the arteriolosclerosis. So the name itself implies arteriolosclerosis means the name is arteriolo is there, arteriole. That means the sclerosis process, the hardening of the wall process, is involving the arterioles and smaller arteries. And typically what occurs in this arteriolosclerosis is typically seen in patients with two conditions, hypertension and diabetes mellitus. They are involved by this arteriolosclerosis. Their arterioles, their lumen gets narrowed by this arteriolosclerosis process. And there are two subdivisions also, like hyaline arteriolosclerosis and hyperplastic arteriolosclerosis. Hyperplastic arteriolosclerosis is usually seen in more severe form of hypertension. It typically causes onion skinning of the arterial wall. But I've discussed that in a separate session, in a specific session on arteriolosclerosis. So the key point here, you know right now that arteriolosclerosis is a type of arteriosclerosis which involves the wall of the arteries and typically causes the lumen gets narrowed of the arterioles. That's why the problem occurs. And typically arteriolosclerosis is seen in the patient of hypertension and diabetes mellitus. Now, the bigger problem, the bigger dangerous or lethal form of arteriosclerosis is atherosclerosis. Atherosclerosis does not involve the arterioles or the smaller arteries. Rather, it involves the larger, the bigger arteries, like the elastic arteries, conducting arteries like aorta, particularly the abdominal part of the aorta, and it also involves the larger muscular arteries. And atherosclerosis, the process is basically, it's a type of arteriosclerosis which typically involves tunica intima. We know that Blood vessel walls, arteries, they have three layers: tunica intima, tunica media, and tunica adventitia. Atherosclerosis is a typically disease process which involves tunica intima, and in this tunica intima there is a fibrofatty plaque formation occurs. That means the plaque which is made of lipid and the fibrous tissue. Plus there is inflammatory cells like lymphocytes, foam cells, all these things there. And these plaque formation, which also called atheromatous plaque, they basically narrows down the lumen of the larger arteries like carotid arteries, then it involves the aortas, and this is a major problem actually. This form of arteriosclerosis is a major problem which causes myocardial infarction, cardiovascular related death, roughly 50% of the causes. It all causes all kind of peripheral vascular diseases, gangrenes, everything, stroke. So the point is that atherosclerosis is actually nothing but a form of arteriosclerosis, but it is different from arteriolosclerosis, because atherosclerosis is a form of arteriosclerosis which involves the larger arteries. As I mentioned, the larger elastic arteries and also the larger muscular arteries, the elastic arteries and the larger muscular arteries. And the problem is that the lumen gets narrowed by the formation of the fibrofatty plaque. I have discussed about the atherosclerosis. It's a totally vast topic, and I discuss it here, but the point here I want to tell that all atherosclerosis are arteriosclerosis, but all arteriosclerosis are not atherosclerosis. There's a concept you need to understand, because arteriosclerosis, the generic term, the whole umbrella term, means hardening of the artery. It is of many subtypes like ArteriOLOsclerosis, like Monckeberg's medial calcific sclerosis, like fibromuscular intimal hyperplasia, like atherosclerosis. So atherosclerosis is just a type of arteriosclerosis. Similarly, ArteriOLOsclerosis is a type of arteriosclerosis, and arteriosclerosis is the whole term. So right now we know the difference. That just a quick summary of 30 seconds. Arteriosclerosis means a process, pathologic process through which the arterial walls, they lose their flexibility, elasticity, the walls get hardened. This whole process in general is called arteriosclerosis. Arteriosclerosis of many forms. Two important significant forms with a lot of clinical application is the atherosclerosis and arteriolosclerosis. Atherosclerosis is the most significant form, causes roughly 50% of cardiovascular related death. And another form is there, it is called, which in atherosclerosis involves the larger arteries, the larger elastic arteries and the larger muscular arteries. And arteriolosclerosis involves the arterioles and the small arteries. And arteriolosclerosis is also of two types, hyperplastic and hyaline, which I will be discussing in a separate session. This is the basic idea actually. Thank you so much.